The College of Surgeons of Sri Lanka is 50 years this year, 2021. It's Golden Jubilee year. I have the pleasure of talking to its president, Professor Srinath Chandrasekhara, President-elect Dr. Satish Gurasinghe, and the Honorary Secretary, Dr. Ranga Vikramarajchi. Professor Chandrasekhara, as president, tell me, what is the College of Surgeons of Sri Lanka?
The College of Surgeons of Sri Lanka is a professional body which represents all specialist surgeons in Sri Lanka. What is special about the college is that at its inception in 1972, this college had only a membership of less than 50 surgeons. Today, we are very proud that we have more than 600 practicing specialist surgeons who are members, and more than another 200 who are in training who are going to be joining us very soon. Similarly, 50 years ago, surgery as a specialty had only a few subspecialties such as cardiothoracic surgery, neurosurgery, and orthopedic surgery. Not only in this country but across the globe, surgery has now evolved into organ-based specialties, and we are very proud that Sri Lanka as a country and the College of Surgeons as a professional body has been able to evolve into these dynamic changes, and today we have more than 10 subspecialties like the rest of the world. The most important aspect of the College of Surgeons of Sri Lanka is that it represents not only one group of surgeons, but those who serve the Ministry of Health and the state, the universities, and those in the private sector as well. And the important or the more key stakeholders of all our activities are our patients, to whom we serve at grassroots level.
Well, having said that, Dr. Gurasinghe, how does the college contribute to us Sri Lankans?
We have excellent free health service in the country, offered by some private sector inputs as well. And our surgical services are spread over all the 9 provinces, in all the major cities and even small towns. And that has a relevance to the people. And our members represent, we are the College of all surgeons, so we serve the population at large. And the Sri Lankan Health Service has been used as a model even by the UN and the WHO as an excellent model for a developing country. So we as surgeons, unified in the college, strive to give excellent surgical services to people in all parts of our country.
This is a special year for the college, isn't it, Professor?
Yes, as we mentioned, it's a Golden Jubilee. So we want to make it an opportunity to reflect on the development the college has had and the progress, which is in numerous ways. Firstly, we have now grown into a fraternity of over 600 members, and at the beginning we had only less than 50 members at the College of Surgeons. Now, this development impacts mostly on our beneficiaries, which is the people of this country. So we want to bring in various programs to engage in a more comprehensive manner with our key stakeholders, which is the general public.
We spoke of programs. What are these programs in this Golden Jubilee year of yours?
There are numerous programs that we have planned in keeping with our vision and what I've already mentioned. Firstly, we want to address some of the key issues the general public is faced with regards to surgically related problems. And amongst these, trauma care is one of the foremost. As you know, trauma is one of the biggest burdens surgeons face in terms of caregiving. And the College of Surgeons this year has decided on a medium to long-term program where we will be engaging with all key stakeholders such as the Ministry of Health, the WHO, and other organizations which are involved in preventive health services to make trauma care more comprehensive in this country. So it's a very large project, and it will be taking several years to implement these programs, but we have taken it upon ourselves to engage with all these people. Secondly, we want to go to the grassroots at a time when communication and physical presence is a big problem, and this program that we're initiating today is one such activity. So we want to use all the virtual communication means to reach our people, to educate them about important surgical problems and its prevention. This year, for the first time, we have also initiated a program to acclimatize and familiarize young doctors who pass out from medical schools and those who come from overseas to serve our country, to acclimatize themselves and familiarize themselves with the new duties that they are trusted with. Importantly, as a professional body, it's one of our key responsibilities to enhance the professional capacity of our members. We have already come a long way where the Sri Lankan qualifications are now internationally accepted without any further qualifying examinations, and this has been largely due to the efforts of the College of Surgeons and the high standards maintained by the Postgraduate Institute of Medicine in this country. We now have over 10 specialities, and the college is collaborating with all other stakeholders, especially international colleges and other accrediting organizations, to enhance these aspects of professional empowerment.
Dr. Gunasinghe, talking of public awareness programs, why are such programs on surgical problems and diseases more and so important?
Things have changed over time now. There's immense proliferation of social media and YouTube and different channels. People have access to mobile technology. So rather than having traditional lectures or leaflets or brochures, having programs through the social media helps to people to understand detection of disease, early detection of cancer, and prevention of disease in a realistic way. So with the proliferation of these media, the college thought that it's of immense relevance.
Dr. Ranga, what is the aim of the social media-based public awareness programs initiated and launched by the College of Surgeons of Sri Lanka in this 50th Jubilee year?
Yeah, we know the public, the social media is very popular among public. So, and particularly in this era, the circumstances are such, the health guidelines prevent us gathering together. So, I think this is the best approach that we could have to reach each and every Sri Lankan to bring the message.
Doctor, what will these programs contain?
Initially, of course, it's a multi-step program. Initially, we are going to start with this YouTube channel programs, which I will be sharing on Facebook and the college website as well. That will cover more than 70 areas of surgical interest of a varied gamut of surgical disease. And later on, we'll get feedback from the public and try to develop, modify and change according to the needs of the time, the people and the surgeons.
Dr. Ranga, what languages are these programs going to be in?
Well,
Which language?
Obviously, Sri Lanka is the multinational racial country. So we need to reach both Sinhala, the Tamil speaking community, as well as English. So we need to be familiar with their own language so we can effectively pass the message.
And how can the public access these programs which you would roll out this year?
So as mentioned earlier, we do have the college runs social media platforms such as Facebook, Instagram, and then the YouTube channel, our own channel, and as well as our website. So it's freely accessible to the general public, so and get the health message.
Professor, you were inducted as the president of the College of Surgeons of Sri Lanka in its 50th Jubilee year. What can the Sri Lankan public expect to see from the college in the next 50 years?
I think while we look back and rejoice the developments that have benefited the general public immensely, I think this Golden Jubilee is an opportunity for all of us to look forward to the next 50 years. And in doing so, clearly we see Sri Lanka and its surgical services being a beaconing light in Asia. We have all the ingredients to do so: our geographical location, our internationally accredited fraternity of surgeons, and the high standard of surgical care that is delivered in this country. So, firstly, I think we aspire to improve our services and our level of accreditation, skills, and knowledge in serving our people better. I think this is a big subject, so in doing so, we have already achieved the objective of making surgical services, emergency surgical services, available within 1 hour of traveling distance in any part of the country, whether it be Mena, Jaffna, or Panthuta, or the Eastern Province. So that is a big achievement for a developing country. In the next 50 years, our primary focus would be to improve on this framework and the structure that we have been able to achieve. So we want to improve the quality of services of our surgeons and engage very actively in the professional development of our members.
It was nice talking to you, gentlemen. Professor Chandrasekhara, Doctor, good luck to you and all the very best to you and your team in this Golden Jubilee. Thank you so much once again.
Thank you.
Thank you very much. Thank you very much.
The public of Sri Lanka can look forward to now this series of public awareness programs initiated and presented by the College of Surgeons of Sri Lanka on social media to educate themselves on common problems, talking to a wide-ranging panel of specialists. So keep watching the College of Surgeons YouTube channel and lots more to come. Thanks for watching. Thank you, everybody.